All right. Hopefully, everyone has connected to audio. Welcome to our 2023 Self Direction Virtual Conference Series. We're thrilled that you could be joining us today. My name is Molly Morris. I am a Vice President at Applied Self Direction, and I'm joined by my colleague Merle Edwards Orr, who is a Senior Advisor at ASD. And we are really excited to be hosting today's session, Under the Hood, a self-direction Q&A with state programs. But before we get into the fun, good stuff, I'm going to run through some quick housekeeping items. First, your audio and video have automatically been turned off. If you do have any questions or comments, please feel free to submit those via the Q&A box. We will address as many of your questions as possible at the end of today's session. The session is being recorded and it will be available on our website following today's session. And closed captions for the entire conference series are available courtesy of our premier sponsor, Avero. We are delighted that as part of our virtual conference series, we could include a discussion with state administrators. I think that there's no better way to really learn about how self-direction programs operate than kind of getting to look under the hood, see behind the curtain in different programs and learn about the decisions and successes and lessons learned from other states. So we are tremendously lucky to have a wonderful panel joining us today. Each of our panelists is going to tell us a little more about their programs, but I just want to start by making introductions on who we have with us. Victoria Elridge is joining us. She's the Commissioner of the Department for Aging and Independent Living in the Kentucky Cabinet for Health and Family Services. So welcome, Victoria. Julie Foster Hagan is the Assistant Secretary for the Office for Citizens with Developmental Disabilities in the Louisiana Department of Health. So thank you, Julie, for joining us. And last but certainly not least, Becky Thomas is the Director of the Personal Preference Program at the New Jersey Division of Medical Assistance and Health Services. So thank you to our panelists for taking the time out of your very busy schedules doing important work to join us for this conversation. I'm going to kick us off just by asking each of you to share just a brief introduction about your self-direction programs and share a little more about that. So Victoria, if you could get us started, we'd love to hear more about what's going on in Kentucky.
Absolutely. I'm honored to be here today. And thank you all so much. I know we are all very busy and I really appreciate the time you're taking out to be here with us today. So Victoria Elridge, Commissioner for the Department for Aging and Independent Living, we have a phenomenal wealth of programs. But I do have to take a minute out to give a shout out to any of the Kentucky staff or Kentucky providers on the call today. We could not do this without each of you. So thank you for being a part of Team Kentucky. We have a myriad of programs that support an array of individuals, including children all the way up to 110 years old, support older adults, individuals with disabilities, also support individuals with traumatic brain injuries and individuals with intellectual and developmental disabilities. At this time, we are supporting almost 13,000 individuals that are self-directing through a myriad of the Medicaid waiver programs and also through state general funded programs. So we have 6 HCB waivers. Of that, 5 of the 6 do support self-direction. The one that doesn't is a ventilator dependent program. And 3 of the programs that we also have in addition to that allow for self-direction. One is specific to individuals with traumatic brain injury. Another one is specific to individuals with the functional loss of 2 or more limbs. It's called our our PCAP program. Participant care attendant program. And that one specifically has been around for a very long time. For those of you that are familiar with the evolution of the disability advocacy program, the PCAP program in Kentucky came about after the 504, but pre-ADA. And I would be remiss if I did not just do a very much honorable mention to Judy Heumann, truly the mother of self-direction. So I know she holds a special place in our heart. So within that, though, of those programs, we truly encourage each individual to have as much oversight over their programs as possible. So we work with our area agencies on aging and independent living, as well as our community mental health centers to be that fiscal agent provider for the Medicaid programs. For the staff, for state programs, it's program staff. And then also for authority, it's the participants get full budget and employee authority. We fully support the right to choose. As far as requirements go, what is required? You have to pass background checks, negative for tuberculosis, and CPR and first aid training. And if you're going to be driving a participant around in their car, you have to have a license and car insurance. And then Kentucky started about 6 years ago or so. We developed our own internal attendant care training. So participants have to go through that training. So we're so excited to be here and to share more information. So thank you so much.
Thank you, Victoria. That was really great to hear about what's going on in Kentucky. And Julie, why don't you take us away and talk about Louisiana?
Sure. So thank you. And again, thanks for the opportunity to share some of the things that we're doing in Louisiana and for the opportunity to learn from other states about some promising practices. And I'll apologize ahead of time. I suddenly decided to have an allergy attack right before talking. So excuse me if I'm clearing my throat. But here in Louisiana, under the Louisiana Department of Health, we have two primary populations that we serve in our through self-direction, our self-direction programs. And those include people with intellectual and developmental disabilities through the Office for Citizens with Developmental Disabilities. We also have a self-direction option for people with adult onset disabilities and the aging population through the Office of Aging and Adult Services. I'm the director for intellectual and developmental disabilities, so I'll speak. Most of my comments will be there, but we consider the Office of Aging and Adult Services our sister agency. In fact, we're right across from each other, and we often collaborate on lots of things related to waivers, but specifically our self-direction programs. The number of people we have who choose the self-direction option for folks with intellectual and developmental disabilities, we have close to 1,800 people using the self-direction option. And then in our Office of Aging and Adult Services, we have close to 200 people. In Louisiana, we have in the Office for Citizens with Developmental Disabilities, we have 4 1915C home and community-based waivers. And our Office of Aging and Adult Services has 2 1915C home and community-based waiver services. And the way that we currently enroll, or we currently use, we don't have a separate self-direction program for folks that are receiving services through those waivers. There is an option that they can choose where they can either choose to go with a traditional provider agency, or they can choose to go through self-direction. And those services are primarily what we call unit-based services, or services where there is billing on a 15-minute increment. But instead of having a traditional provider agency that you go through in self-direction, you then are able to self-direct your services in the form of choosing to hire your own staff and have more autonomy in that way. The way that is operated here in Louisiana is currently we have 2 fiscal employer agencies. So when people choose the self-direction option, they are able to choose from one of 2 statewide agencies. We are making some changes to that, which I'll explain later. But right now, when you do choose the self-direction option, one of your choices then is to interview and select which fiscal employer agency you would like to choose. Within our Office for Citizens with Developmental Disabilities, right now, we do have employer authority as the authority we use for that self-direction. Again, we'll talk more about that, but we are looking to shift towards budget authority. And then in the Office of Aging, there is budget authority for those folks who do choose the self-direction option. In terms of hiring restrictions, because as I mentioned, a person can either choose to receive their services through a traditional provider or through self-direction. One of the things we say is that those in self-direction have to meet all of the same requirements that we have in place, many of which are very similar to what my peer talked about in Kentucky. And then the only additional hiring restriction we have above and beyond what other direct support workers would have is that many of the people in Louisiana who choose to self-direct have an authorized representative, which is not related to any kind of legal status, but only related to they're the person who are assisting them with the things that they need to do in self-direction. And so if a person is identified as the authorized representative who is helping the person receive services to self-direct, they are not able to then also be paid, because in essence they're kind of hiring and firing themselves. And so it was determined in Louisiana that in the way that we have it laid out at this time, that would be a conflict of interest. So that's the only hiring, I guess, restriction we have in place. Other than that, they meet the traditional guidelines. So I will stop there and turn it back over to you, Molly.
Thank you,
Great.
Julie. And again, last but not least, Becky, tell us about New Jersey. And you're muted, Becky.
I am the queen of talking on mute, so sorry about
Me
that.
too. Me too.
Oh, cool.
We'll take turns.
Hey, everybody. Becky Thomas with New Jersey. So our program is called the Personal Preference Program. So we serve our Medicaid and NJ Family Care members who have an assessed need for personal care services. As of March, we are serving almost 29,000 members. The funding source for our program. So we offer this through our state plan and through our 1115, so that we can also assist our MLTSS waiver participants. We want to make sure that anyone who has a personal care need is able to have an option. You can choose your PCA services through a traditional agency. And you may also opt to do self-direction. This is done through options counseling through your health plan. And when, or if you fall into a fee-for-service window, you can continue to self-direct. But it's a way for folks to have an informed choice. And we have seen the program grow exponentially by opening up the opportunity for folks that are receiving PCA that are not in a waiver. So we wanted to open up access to create that personal care focus, that person-centered planning focus, and put it in the state plan opportunity that has served a lot of our waiver participants in other programs and other opportunities. Let's take that great model and add that to personal care and make it more accessible to additional folks. We also use the fiscal employer agent. Right now, we have one vendor in the state that we work with, and they contract with our health plans to provide this support for our members that utilize this service. And we use budget authority with optional goods and services. So we allow folks to use their self-directed option to save up for items if it would help them with their ADLs, their activities of daily living, as an option to perhaps not need to hire or pay someone to use that. They can use it to save towards an item, say a washer, or something that would help with their need of having assistance with laundry. It's a way to build in the ability to manage your own needs in the way that suits you as a person. We also find that it's a great way to support our members and their families as a way to treat the person in a holistic point of view. As far as our hiring restrictions, each individual that wishes to hire someone each person, the potential employee has to go through, they get bumped up against 3 lists. So it's the OIG list of excluded individuals and entities. We have New Jersey's Medicaid Fraud Control Unit has a provider exclusion list that you need to make sure that you're not on that list. And then the New Jersey Central Registry of Offenders against individuals with developmental disabilities. The focus here is to make sure that we're assuring that selected caregivers are have no concerns that would put any of our membership in jeopardy in any way. And those are, and I will share, we also have a similar rule with authorized representatives. If you were serving as someone's authorized representative, you cannot be a paid individual. So thank you for pointing that one out. That was really helpful on our end as well. So thanks. Thanks for the opportunity to share a little bit about New Jersey.
Great. Thank you. That was a terrific kickoff. And now we're going to say, so what's changed? We've seen nationally that the pandemic has had a major impact on self-direction. Some states have seen significant growth or have expanded their flexibilities. So we'd really like to have you now talk a little bit about how has self-direction evolved in your state over the last few years, and have any recent changes that you may have made as temporary changes you plan to make permanent. And why don't you kick us off on this one?
Sure. So we have, you'll see that our numbers in Louisiana are smaller, but we have been excited that we have seen a slow and steady growth over time. And we have seen during the pandemic, more families wanting to choose the self-direction option. So we are excited that we're continuing. We know we still have ways to go, but we are excited that we are really continuing to see more people select that option. I think we're seeing that because we've also had a lot more attention from our stakeholders and our stakeholder advocates. During the last couple of legislative sessions, there have been topics that have been brought up around self-direction and our self-direction program, and the things that our state offices need to do to make sure that our systems are easily navigable and efficient, that we have efficiencies that help support people with that decision making. So we've seen a really increased attention, not just for people choosing it, but for advocacy and legislative folks who have paid attention to it. We did make some changes during the pandemic here in Louisiana, specifically around family members being able to serve as paid caregivers. Had we not, before the pandemic, if you lived in the same home, we had a lot of restrictions around being able to be paid. And what we saw during the pandemic is that if we would not have been able to pay family caregivers living in the same home, we would have had people in some really negative situations. And so it helped us to learn. And so one of the things we are planning to do post-pandemic in our self-direction and overall in our waiver program is to have items in our activities in our waiver, which we have already received approval from CMS in our waiver to make those waiver applications.
Okay.
To be able to now, we have to establish safeguards and parameters per CMS guidelines, but we have included those in our waiver application, and post PHE plan to continue those, which especially for our folks in self-direction, we've heard from families that it's critical that we looked at that, and that's something that we plan to continue post-pandemic.
Great. Thank you. Becky, what's been going on in New Jersey?
So we, similar to Julie's feedback, we launched into action pretty quickly with the onset of the PHE, understanding that as facilities were closing and lack of access to services was going to have a large impact on our state, similar to PCA agencies or day programs that would become challenging. So we were fortunate to work with our vendor and figure out how we could take as many services that we have and move them to telephonic or online opportunities. So we were able to move hiring and onboarding, enrolling, a lot of these services that required either a face-to-face or had longer term things were handled through the mail. We said, how can we make this more impactful and effective in a more immediate way? So we implemented DocuSign. We took opportunities to make face-to-face appointments online or telephonic. And we were able to move those along very quickly. We had a lot of interest and support in that way. A lot more people were able to receive updated assessments to see where the gaps in care were determined based on the changes with the closures, et cetera. And through that, we found that there was a great opportunity for innovation. So one of the things that we've been able to maintain is keeping the online processes that keep things moving along, rate changes, things that can be done through an online conversation or can be managed with a DocuSign. We've kept those things in place so that tasks that someone is, while they're self-directing and want to take action on items for their worker, those can happen in more real-time effectiveness. And we've also created a kind of an escalated enrollment process. So if you have someone who is emergent and they are in a situation where they need services quickly, we have created a way for an individual to be enrolled slightly more quickly based on their unique needs. And it was a great opportunity to see how services that are, these will never change, nothing's ever going to change. And it was like on a dime, we had to change.
Wow.
And really grateful for all the abilities that everyone brought to the table and ideas so that we could move forward. So it was a hard experience that we all found value. So thanks.
Great. And Victoria, what about Kentucky?
So first, I'm gonna say, Becky, I would love to hear more later on or now after I present on what you did to do to expedite that process.
Yeah.
That's something that we're always looking to do to expedite enrollment in our trying a pilot program to support individuals with dementia, but I'd love to hear more about that. But in Kentucky, we saw substantial growth within our participant directed services, especially when we removed the family member exemption waiver piece to that. So pre-pandemic, family members had to go through an additional process to provide PDS services or to be the employee for the participant. That was waived because in Kentucky, we wanted people to be healthy at home and recognize that having providers, like our public health commissioner had said, we don't want the bees coming in, spreading COVID in and around our vulnerable adults, much like, bees spread pollen. So we really supported and embraced where individuals wanted to, and again, having that choice of being able to self-direct. And what we saw was a number of participants truly embrace that. Again, we all are empowered when we have choice. And within that, participant directed services is the true empowerment tool to direct that. So we saw about a 12% overall increase in the span of, it was about like 18 months, 2 years. So we were really excited to support those individuals. There were some growing pains. I know we'll talk a little bit more about that later to that. So in addition, on top of working through getting all of these new individuals enrolled and knowing who their employee was. Kentucky's a glutton for punishment and decided, during the middle of that, like many other states, to fully implement EVV. So we went live with that at January 1 of 2021 in the thick of the pandemic and starting vaccine rollout. But we did it and we're still standing. And so just very, very grateful to be here and to give an additional support to those who need it. So thanks, Merle.
Great. I'd say I want to make sure, I think I want to keep going so we get a chance to go through our first set of questions, but I really don't want to lose that coming back to you, Becky, about the expediting, because I think that's a very important point. So Molly, I think it's yours.
Great. And I'll just say, we got a note from one of our attendees. It's just a reminder that we all spell out our acronyms. A good reminder for all of us as we speak this special language in each of our worlds. But related to some of what you've discussed with pandemic impact, we all know we're experiencing a nationwide workforce shortage, and would love to know more about how that's impacting your programs and how you're responding. Victoria, do you want to start us on this one?
Sure. So like many of you all, we're really experiencing that, but also see it as an opportunity. Through self-direction, we've been able to support more and more individuals with disabilities as they're having control over who they hire and who their employees are. We saw a lot of individuals who previously had been with traditional providers that came on. And much like Kentucky bourbon, when you hear of a good bourbon, word spreads quickly. Well, like PDS, when you hear of a great program, word spreads quickly. So we saw a number of individuals that were enrolling into our Medicaid waiver program, as well as into our state general funded programs, of wanting to do self-direction, understanding that they didn't have to go with a traditional agency, but they could hire someone they went to church with, a friend down the street, if need be, someone within their home. So we really supported that and continued to get the word out. But also during this time, we brought on an additional provider. Through Appendix K, we encouraged our community mental health centers to come on and assist with supporting the needs of individuals to self-direct, and are grateful for them for stepping up and taking over and sharing that role. We also allowed our area agencies on aging and independent living, or triple A's, as some people call them, to expand their geographic boundaries. So typically an aging provider would cover a 5-county area. Well, it could be that someone in Western Kentucky, they don't have any additional staff and there's people that need services. So an entity in Central Kentucky could assist with that because of having the flexibility to do virtual case management. So we really tried to get beyond our own borders, if you will, to really ensure that all Kentuckians were supported. We also allowed our PDS case managers to bill an extra unit of case management, again, making sure that individual was taken care of and had all of the needs there, especially early on in the pandemic. And then also we increased reimbursement rates. We understood, that with doing the extra work and making sure that the individuals that we're serving were safe and had everything that they needed, that a lot of our providers needed that additional incentive. And it served as a way to ensure that providers were able to retain staff. So again, we're so grateful for all of the providers across the state. Thanks, Molly.
Thank you. And Becky and Julie, I don't know if there's anything either of you would want to add in terms of workforce initiatives or response or impacts.
Victoria really handled it beautifully, so I'll defer to her response. Thank you, Victoria.
I agree. The only thing I would add, we did similar things in Louisiana. We did also find that in addition to kind of the rate of pay and things to be able to support people, there was a really need for training, and that folks in self-direction may have had more difficulty accessing good training as opposed to some of our traditional providers. So we actually developed that training and made it available online, so that as they had new direct support workers that they hired in self-direction, they would have access to that training.
Great. Then we'll just keep moving along here then. Certainly one of the things that we've noticed here at ASD is that stakeholder feedback is really important for developing a strong and robust program. And we would like to hear from you about what strategies your state uses to engage participants. And Julie, I want to ask you to kick this one off because I know Louisiana is doing some very interesting stuff.
Thank you. And we are excited. We have a robust stakeholder and advocacy group for folks with developmental disabilities here in Louisiana. One of the things we did at the request of members was we began a self-direction advisory group that was sponsored through our Medicaid agency, but had participants from our Office for Citizens with Developmental Disabilities and Office of Aging and Adult Services, as we're the kind of the entities that oversee those programs. And the goal of that was really to hear from families who could tell us what are the gaps in services, what are the concerns, what things are working and not working in our system. And then we can take that away and then strategically look at what are things that we might be able to do to improve those. We've had such an outpouring of the people who want to be a part of that instead of just having a small advisory council, we're now moving to have a larger group where we're able to really include anyone in self-direction, because there's just such a need for them to be able to get the message. And so we're expanding that and offering it now to all folks in self-direction. Another thing that we found really effective, when we do have an issue that we're trying to grapple, one of the things we found very successful, and we learned during the pandemic, because we can all use Zoom now, right? Was pulling together what we called focus groups. So before the pandemic, a lot of times we would talk to provider associations in a silo. We would talk to case managers in a silo. We talked to individuals receiving services in a silo. What we decided to do is instead open up an opportunity for people to register to be a part of our focus group when we were trying to make dedicated changes, so we could make sure we had a diverse representation across urban, rural, racial, any type of things that we needed to consider, smaller agencies, larger agencies. And we pulled together a group of about 25 people. We had fantastic results from that. And a lot of folks told me, as a parent, I never really thought about it from the provider perspective, or the provider saying the same thing to us, the case manager saying the same thing to us. We never really thought about that and how it's impacting. And so we definitely plan to continue using that model, because we found it's very successful to taking a particular issue, digesting it, considering it from all areas, and then having a dedicated plan to move forward.
So Julie, I'm sitting here taking down notes.
Notice that.
Yeah, Kentucky is, we're wanting to move in that direction and have some meetings set up with other states. So shout out if anyone's here from Colorado on their PDS stakeholder policy group, or Texas with their PDS policy collaborative. We're working to get meetings set up to learn about them. And Julie, I will be adding Louisiana to that as well. I really like, how you had people register to make sure there wasn't overrepresentation of one demographic or another. So one thing that Kentucky is doing, we do an annual PDS participant survey just to hear what's working, what's not working. But we've also partnered with HSRI, or the Human Services Research Institute. And we're also working with advancing states on implementing the National Core Indicators, or NCI, and the aging and disability piece of that, or the NCI-AD. So we're really excited. We know that data tells a story, and it is so important to make sure that not only are we providing services, but it's quality services, and really looking at the different metrics. The one thing that I strongly dislike as commissioner is just to collect information. I say it's like, your grandma's knickknacks. They're beautiful to look at, but if you're not doing anything with it, then what's the point, right? So, and that's how we feel about data. But we need to make sure for the almost 13,000 people that we're representing, that they have a voice at the table too. So, but again, Julie, I'll be reaching out to you real soon.
I have, I'm also taking lots of notes, so I'll be followed up with you lovely ladies with some questions. I'm definitely really interested in that focus group approach, Julie. I really like that. We too have, I'm gonna probably get into it a little bit later, but we have, we're kind of new at the community portion of self-directed here at the DMOS, but it has started, kind of started a wave, and I'm hoping to continue that process as we move forward. And I'm excited to hear there's so much buy-in in other states about it. because it gives New Jersey something to strive for. So thank you both for that feedback. It's really helpful. Thank you.
Thanks, everybody. Julie, it really is exciting to hear about what you've got going on in Louisiana. And I loved seeing everybody take notes as she was talking. So another topic that sometimes elicits some moans and groans, but I think it's important to talk about is electronic visit verification and EVV. Would love to hear how far along your respective states are in implementation, what have been lessons learned, best practices. And Becky, you've had some interesting stuff going on in New Jersey, so I wanted to pass it to you first.
Sure. So so we have fully implemented EVV for the personal preference program. So we have 5 health plans that are now supporting EVV. And I will be honest, it did not start off with pretty happy flowers and sunshine. There was a lot of pushback and unhappiness. And after we just had this conversation about communication and support from your community, we definitely took that approach by creating a work group specific to self-direction. And it included members and families, their caregivers, advocates in both our intellectual and developmental disability, community partners, families that work on behalf of their family members, plus our health plans and our vendor, our self-direction vendor, because we wanted to make sure that nothing was happening without it being shared and discussed. We initially started as a pilot with one health plan, and we met monthly with this group and listened to the fears, listened to the concerns, and instead of using EVV compliance as a punitive measure, we opted to do it as a education and support process to meet compliance. And the value of that was that we took the change, the scary part of change, which I respect and understand, that when you access these services, the biggest fear is, what am I going to lose? Why is this going to be hard? And I understand that. These are the things that help you live, access your life, have choice and opportunity. And now you're coming in and telling me you want me to tell you what I do all day in my house. That's none of your business. And I respect that. So we took and heard and understand and assimilated those concerns into how we approached EVV. And so far, our compliance rates are increasing month over month because we don't kick anyone out for struggling with EVV. Instead, we work with our fiscal agent to have one-on-one quarterly discussions, continued training, access to support on a regular basis, and making sure that folks know that this is the new norm and we understand it's hard, and we're just going to keep supporting you until you get it. And so far, the results have been positive. Compliance continues to grow, and we found a far better way to address scary change, things that feel invasive, and turn it into an opportunity to make it an implementation that we can all be a part of, instead of it being exclusionary and punitive. So really appreciative of how that process came to be, and our community partners were a humongous piece of taking this, scary thing into a working positive step forward. So thank you for letting me share that. I appreciate it.
Thank you for sharing that, Becky. I know we've spent a lot of time at ASD talking to a lot of states about their approaches to EVV, and it really has been a challenge, and it's really heartening to hear about the approach you've taken in New Jersey. Victoria, I know you also had some perspective to share. Why don't you go right ahead?
Well, we had a little bump in the road, or as one of our colleagues says, we had an opportunity with rolling out EVV. So we launched EVV in January of 2021. And we were about 6 months in and recognized that the vendor we were working with at the time was not fulfilling their contractual obligations, and it was causing a lot of headache. And so, again, partnering with our Department for Medicaid Services, that, as we say, ultimately pays the bills, had a lot of discussion on that. And so that contract was repealed and back out through RFP and moving forward. And so first and foremost, want to say that interagency partnership is essential to make sure that things go right, as well as before launching EVV, there were multiple stakeholder calls and getting individuals to understand, because you're absolutely right, Molly. With change comes fear. We all like kind of the normal, and understanding there's going to be this, huge, technology change, and understanding the system and not knowing, how it's going to work, especially with some limited internet access areas, and what does that mean, and, rural parts of the state. And so it was multiple stakeholders and truly listening and making sure when Kentuckians, when they shared their view, that as a state entity, we took that under consideration. So with that, and then again, with the transition, we really started to see people embracing EVV. And now, the majority, I won't say all, but the majority of waiver participants love EVV, specifically because, it's web-based, and there's increased turnaround time for their paychecks. It's easier to understand. You have a larger scope. And from a state perspective, it's easier to collect data. So I will say that we found EVV extremely beneficial. When we had our two major weather disasters, we had the huge tornado out in Western Kentucky in December of 2021. And then we had the historic unprecedented flooding in Eastern Kentucky in 2022. EVV made things a whole lot easier when you have homes and businesses flooded, looking at paper documentation. So we were really grateful for the collaboration on that. And, it's a long time coming, but I think we all can commiserate over the change, but it's being embraced and supported now. So thank you.
Merle, I think you're muted. You've got the next one there.
Muted. Everybody was sitting there with, doing dead air, and I went, well, that would be me. Okay. Thank you. Kind of shifting gears a little bit. One of the areas certainly that folks want to talk to us about, and so I would love to have you help us out here, is how do you structure information assistance services? And I think well, there are lots of answers to this, but do you use a kind of single kind of case management system, or do you do a case management with a specialist, a self-direction specialist, support worker type who works with them, or some other variation? And that seems to be a very hot topic, and would love to. Would you all have it? And why don't we give you the first shot at this with Julie?
Sure. So I think Victoria used the word opportunity earlier. So this is an area where in Louisiana, we definitely have opportunities to take a look at this. So what we currently do is we have support coordinators or case managers. So everyone that has a home and community-based waiver has a support coordinator. That we don't have different support coordinators if you choose to use a traditional provider agency or if you use self-direction. It's the same. There's multiple agencies to choose from, but you have the same. There's none of the agencies that sort of specialize in helping folks with self-direction. And so those support coordination agencies, they're not, one of the gaps that we've heard from families is that they don't always have the information about how to be an employer or how to really manage that budget. We do have the contracts with our fiscal agents. They're doing the paying, and they're, figuring out how to get people paychecks and things like that. But there's an area in between that has been identified as a gap. One of the things that I've been trying to get, because it'll take additional funding. So I'm trying right as we speak to get additional funding. I know other states use what's called a support broker service. And I believe that we need that, because I believe there's just kind of that in between that families really need that help on and need that specialized help. And unfortunately, I don't know that when we ask just our support coordination agencies here in Louisiana or our fiscal agents, they're not always able to sort of bridge that gap that's needed. And I think it's important that we add that, and we are trying to work towards that. But again, I see that as definitely an opportunity here in Louisiana.
Becky, about how's New Jersey do this?
Thanks, Carl. So New Jersey, we do use, we have INA support built into our contract with our fiscal agent. So every individual that is using the PPP has a one-on-one relationship with what we call a financial consultant. So this person is helps pretty much with every step of the enrollment process, helps the individual with any questions or concerns they have with setting up their what we call a small business, helps with providing guidance related to hiring and guidance and assistance with how to work with a worker if you have any questions or concerns related to hiring, firing, rate increases, things of that nature, how to, they help them with their cash management plans, we call them CMPs. So they meet with them quarterly. They're normally face-to-face. During the PHE, we were able to do those telephonically. We're moving back out into the field. They also have their own health plan touch base as well. So, and each person has their health plan outreach. There's either an assigned care manager, depending on the program, or the health plan, depending on their structure, but you do have outreach to your health plan as well. So there's kind of a circle of care around each person utilizing the program to make sure that their service needs are being met and that self-direction is working for this person. If they find that this individual, maybe, the individual's having issues or self-direction is actually showing a backslide in health and wellness, there's also the opportunity for re-education support, or perhaps you need to move back to PCA agency services, but the choice is always that of the member. But they're there to support any questions they have. And we find that it really helps keep folks understanding the rules, what's appropriate self-direction, and how they can be empowered to, have the program work best for them.
We have a comment that I just want to throw on about saying that the system for folks with developmental disabilities in New Jersey is different. Asking for a clarification between the two quickly. Time runs short, but I did want to respond to that comment.
And I clicked it as answer by mistake. Yeah, I can
Great.
provide a quick answer. So DDD programs have their own self-directed programs. They have two different options, their own rules and requirements, and they have their own contracts. So DDD programs have their own supports process. They have support coordinators. They don't use INA as opposed to the Medicaid program. But to be clear, we do have individuals that access care for their personal care assistance through our ABD programs that can use PPP. We don't, if there's something that you need through DDD, through their waiver programs, that's a different avenue. And that is still accessible to individuals that use New Jersey DDD self-directed programs. I hope that's helpful and answers your question.
Yeah. Thank
you. The other question for INA support, it depends on where the plan. Some plans offer care management to anyone that needs PCA, and others are required based on their waiver status.
Okay, great.
Mm-hmm.
Victoria.
So time flies when you're having fun. Can't believe we only have like 10 minutes left. So I'm going to keep this
I know.
short and sweet. So, which is a surprise to my Kentucky friends. But in Kentucky, we have our case managers. So on the waiver side, your service advisor, but for our state general funded side, it's a case manager. They are the primary responsible party for providing that information assistance. So we make a very concerted effort in ensuring that that individual understands their roles and responsibilities and the flexibility that they have and are there to support them with any questions they may have. We know how important it is to have a peer, someone to say, hey, I've been there before, here's how you can help it out. And again, word of mouth spreads pretty quickly. So there's a lot of different entities that people can lean on.
Thanks so much. And time really does fly when you're having fun. I'm just noticing these 10 minutes. Our next question, I really don't want to lose because it's such an important one. But I do want to just encourage folks in the time we have remaining, if you want to ask some questions on the chat, feel free to submit those now. And we'll try to make sure we get those before we wrap things up. But I'd love to talk about to what extent you're able to track whether all eligible people have equitable access to self-direction. And this is an area where I think we're needing nationally to give a lot more attention to. And Victoria, I'd love to just start with you in terms of what you see there.
Sure. And thank you for that. Equity is one of the foundational points within the Cabinet for Health and Family Services in Kentucky. We look at it through a various lens. We look at it through health equity, through racial equity, through pay equity, and a myriad of other lenses. Within that, all three of those are critical to self-direction, especially within the racial equity and, what has gone on and continues to go on across our country. And so it's also ensuring that that intersectionality of individuals with disabilities and how they identify, ensure that they have pay equity, especially for the employees so they can retain employment. It is absolutely critical. And so we've been able to increase our flexibility within that through Appendix K and are looking to see how we can continue that once the public health emergency is over with. Again, making sure that we are competitive within the market. So I will also say we have within our contracts that anyone that works with the Department for Aging Independent Living or contracts out, that they have to undergo cultural competency and racial equity training to ensure that they truly understand and are aware of their own internal views and how that may impact the individuals that are being served. So we monitor that through provider certification process and making sure that all of the providers have that equity piece in their policies and procedures. So thanks, Molly.
Thanks. Becky and Julie, I don't know if there's anything else you would add on this topic.
I want to know more about that cultural competency piece, so I'll be following up with you, Victoria.
Great. And speaking of following up, I think now is the time to swing back and not lose that conversation about expediting folks as they were trying to get on the program, which you raised very early on, Becky. And so I wonder if you could talk us a little bit about what that looked like and how that worked.
Sure. What we did was we determined we worked with our vendor to determine how we can prorate a budget, how we can move things forward with requesting our workers' compensation requirements, and moving folks through all the different unique pieces. A big piece of it was moving things online, so you didn't have to wait for scheduling an appointment to do a face-to-face for onboarding. So it was moving as many things into to online or telephonic. And another piece was making sure that we can set up these appointments before we have a cutoff period when for attaining a workers' comp policy. That's a big piece where there's a certain time of the month, but if you miss that date, you're going to have to wait. So it was really working with timing and asking our health plans to be mindful and making sure that they were getting their pieces into the enrollment request as quickly as possible, and making sure that they were communicating with both us and the fiscal agent about expedited cases. And that those pieces really helped move enrollment along very quickly.
That's wonderful.
No, that's great.
I'm just oh wait, let me see. Looking at the time.
Right.
You know, we were gonna ask a couple more questions, and I'm wondering maybe if you each want to just share one last thing about what's going on in your state, either a best practice or something exciting coming up in the future that we could kind of end on that.
Right.
Maybe Julie, do you want to start us off?
Sure. And I hit on some of these. For us, we're really looking forward to continuing our communication, continuing to increase opportunities for people to have a better understanding of our self-direction program so that we can continue to see it grow. And hopefully we can continue to have more forums like this, because I think it's really important as state leaders that we learn from other states, what's working and what's not working, and be able to share those opportunities. Thank you.
Thank you, Julie. Becky, how about you? I see you're unmuted, so.
I just wanted to share that one of the positives, another positive that came out of the EBV, and it aligns with Victoria and Julie's experiences, is that we've taken that monthly meeting that we had for EBV and we've turned it into a community partnership forum that we are, and we've added some folks, and now it's become a regular part of the PDP experience. So here and cheers to my colleagues here who understand that and are setting the pace for that. And I'm eager to hear everything they're doing is awesome, and I want to learn more. So thank you.
So I will just add that Kentucky received an Administration for Community Living grant to work with the National Center for Advancing Person-Centered Planning, or NCAPS, because we love acronyms. And so to that, what we have done over the past couple of years is developed a core set of competencies for all case managers on the PDS side of the house, as well as for our state-run programs that the department oversees. And it has been through extensive stakeholder engagement. It is listening to providers, listening to family members, individuals with lived experience to truly understand what is self-direction, because my view of self-direction as an occupational therapist could be different than Julie's view of self-direction, which is different than anyone else's view. But really, what is self-direction, but also what does person-centered practice mean? Specifically to that, each person is their own individual being. And so we are going to be rolling those out. And also we look forward to forming our own PDS stakeholder coalition to ensure that Kentuckians have that voice. So Molly and Merle, thank you all so much. This has been phenomenal, and grateful to everyone that's been on here as well.
Right.
Thank you.
No, I say the same thing. I've had to agree with everyone. This has been great. It has been fun, and so thank you so much for your contributions. Thanks to all the people who took the time out of their busy days to come and listen to us. And I think we can just say thank you at this point, and farewell.
Thanks for having us. Thank you.
Thank you, everybody.
Take care.
Thanks very much.
Bye.
Great.